Hi guys, welcome back to my channel. The purpose of the video is to the purpose of this video is part of 3 videos that I've recently made. The aim is to help you to understand how to evidence your work on the Equality and Diversity unit in the QCF Diploma in Healthcare Level 2. This unit is aimed at those who provide care and support to individuals with dementia in a wide range of settings. The unit introduces the concept of equality and diversity and inclusion that are fundamentals to person-centered care practice. The aim, of course, we're looking here at offering, combining a guided learning of about 20 hours for your unit. There are ranges of learning outcome, 3 main learning outcomes that we're intending to cover here to provide you with the support. This presentation, a group of videos, and some worksheets I've arranged for you. But the unit can be covered through these learning practices, your real work environment, and writing a personal statement of your understanding of how of equality in diversity. We aim to look at these the learning outcome 1.1. What does it ask you to do? It asks you to explain the importance of recognizing that individuals with dementia have unique needs and preferences. So, what do we know about that? This is important because 1, it allows for individuality. It enables choices. Recognizing individuals with dementia are unique, have unique needs and preferences, enables social relationships. It values the individual. It provides the opportunity for mental stimulation, empowers the individual, encourages inclusion. The individual is considered as a unified whole. In this section 1.2, it asks us to describe ways of helping carers and others to understand that an individual with dementia has unique needs and preferences. We can do that by applying the principle of care. We need to promote equality, working in a way that encourages an anti-discriminatory manner, maintaining confidentiality in care, promoting the rights and the beliefs of the individual with dementia, challenging anti-discriminatory behavior, maintaining quality assurance procedure, for example, code of practices, and applying legislation to the settings, and ensuring that the organization has adequate complaints procedure. Explain how values, beliefs, and misunderstanding about dementia can affect attitude towards individual. What are these? This includes stereotyping, labeling, prejudice, patronizing others, poor communication, thinking of an individual as a burden, not placing any value on individual, blaming individual for their condition and stigmatizing them. What are some of the negative effects of misunderstanding? The person that we're caring for feels like they're not valued, becoming withdrawn or isolated. There's a lack of cooperation. They tend to start to get aggressive. They could also, resort to verbal abuse. They usually tend to have a low self-esteem, making the individual feel uncomfortable, which can result in behavior problem, feeling excluded. What are some of the positive effects when we value people's beliefs and preferences? We find that our service users have a higher self-esteem. People feel the value. They feel we encourage inclusiveness. We promote rights of individual. Empower individual encourages a positive attitude. Promote equality and recognize diversity. What are we required to do in outcome 2? The learner will be able to describe how an individual may feel valued, included, and able to encourage in daily lives. Describe how individual with dementia may feel excluded. Explain the importance of including the individual in all aspects of their care. Why is it important? How does an individual feel valued, included, and able to engage in daily lives? We can do this to improve communication, being able to participate in leisure activities, being able to have a sense of inclusion, have a sense of belonging, feeling able to cooperate with others by contributing in their daily living task, through being able to express their own emotions by having a sense of humor, having a sense of hope. Feeling excluded by carers. If a service users feel excluded by carers, this can be done through a discriminatory behavior like shouting, ignoring, lack of respect, not recognizing the diversity of individual, not providing equality of care, not following organizational requirements, example, policies and procedures, ignoring the legislation that promotes equality and diversity, example, Data Protection Act, the Discrimination Act, and the Equalities Act of 2010, not maintaining confidentiality. Importance of including the individual. We want to improve sense of identity, able to celebrate personal life event, able to make choices, have a higher self-esteem, more involvement with outside agencies. That makes making people feel included, attachment, they feel accepted, able to make decision, able to take more control of their lives. In this learning outcome 3, we're asked to understand ways of working with a range of individuals who have dementia to ensure diverse needs are met. So, we want you to describe how the experience of an older individual with dementia may be different from the experience of a younger individual with dementia. Describe what steps might be taken to gain knowledge and understanding of the needs and preference of the individual with dementia from different ethnic origin. Sorry, just go back there. Oops. Describe what knowledge and understanding would be required to work in a person-centered way with an individual with a learning disability or dementia. What does person-centered way mean? A person-centered way, this is a way of working which aims to put the person at the center of the care, taking into account their individuality, wishes, and preferences. Differences. We ask you to look at the differences between a younger person with dementia and an older person. What happened if you were a younger person with dementia? Being at work at a time of diagnostic. This can be very frightening. Having dependent children. having financial commitments, being physically fit, but having dementia can make the person feeling very confused, being more aware of their disease in early stages, finding it hard to accept, finding it difficult to access information, living on their own, more socially active. In the older age, the older person is less aware of the effects of the disease, often too frail to care for themselves, may not be physically fit, may not have any finances to support themselves, may not want to move away from their home or their family, may have a sense of impairment, insufficiently occupied. Steps for an individual with different ethnic group. What can you do for someone from a different ethnic group? Find out about the history of the individual. Obtaining information from the individual, exploring language preferences. Provide an interpreter if needed. Consult with families over lifestyles, diet, clothing, hobbies, etc. Consult about cultural needs. Provide information in the individual's own language. Working in a person-centered way. What we want to do here is we want to complete a cognitive ability profile. Identify supportive care intervention. Adopt a universal procedure. Adopt the principle of believing. Validate the individual feelings. In order to complete this work, you have to evidence your work. And this is called the assessment process. This unit needs to be assessed in line with the Skills for Care and the Development QCF assessment principle. The candidate will have to produce a portfolio of evidence that meets the requirements of learning outcome and assessment criteria in full, taking into account additional knowledge and understanding of the skills specified in the unit. I've also done for you a video on my YouTube channel, which gives you more information and how on diversity and inclusion. You can also look at these websites for further reading. I'll go into my videos where you can have a look. I suggest you spend some more time watching the playlist that I've put together for you on dementia. It's got about an hour and a half. Look at it and come back.
From Parkinson.
Look at it. You don't have to complete the video in the video learning in one, but there are a group of videos that I've selected for you to look at different ways in which we can work with people with equality and diversity and inclusion in dementia care. I can see a little bit of an error there. I've got to go back and fix that for you because it says dementia care. Okay, so we'll go back and fix that in a moment. I've also done a personal statement. And this is a typical personal statement, but you might find it very useful if you are writing a personal statement and you need to evidence your work. It's about your daily life. It's about what you do in the everyday practice at work. So I'm going to read it out for you. In a discussion with learner X, informed me that at X care home where she worked in a mixed unit for individuals with varying needs, including dementia and old age. She then said that I would try to start a conversation with the person I'm looking after. She tries to encourage them to participate and to encourage and engage with them actively in communication, especially if she noticed that they start in fewer conversations themselves. Learner X reflected on occasion when working with Mr. A, an elderly 82-year-old man with advanced dementia. She remembered speaking clearly and slowly, using short sentences. I won't read out the entire of it, but the purpose of this is to, although it's not grammatically correct in all aspects because I haven't had the chance to review it all before writing this video. So I will come back and edit this video later on. But because so many of you are calling in for this video, I've done you a quick one. Basically, this is an account of what actually happened, and it's also a discussion between this learner and the assessor. I've added it here in the video, in this learning guide, because it shows you how you can put your own personal statement outlining your real work examples so that when sent it in to me, I have an understanding that you're fairly competent because you've evidenced your work in the form of a personal statement. It looks at areas such as communicating through body language. We talk about different communication methods. We talked about, what you can do to help your patient, your residents with dementia. She also given me real work experiences. So she told me she also remembered another occasion when she had a service user with Alzheimer's who was significantly confused and agitated, and that she would pat or hold the gentleman on his hand while talking with her to help reassure her. Well, sorry, the lady, to reassure her, which makes her feel closer. She would watch body language and listens to what was said, whether she thought it was comfortable or not. A lot of carers don't always get an opportunity to make a support plan for your residents because you're on level 2 of the NVQ of the Diploma in Healthcare course. However, we find that although you don't get involved in writing the support plan, you read the support plan. It's where you go for information about the service user. You also find out information by talking to their family. We want to know how you get involved, even if you're not writing the support plan yourself, how are you involved in the service user's support plan? How do you ensure that communications aren't misunderstood? Okay, and then we want to know if we're in doubt about the person's cultural backgrounds and what they like, how would you find out about more information of how to care for the residents? What do you do in the daily work environment for persons with dementia, encouraging diversity and inclusion? You've got to think about what you're doing every day in the context of your work and evidence it. Thank you for watching, and don't forget to subscribe to my channel for more information about the Diploma in Health and Social Care.